Good afternoon. Thank you for joining the webinar. My name is Elizabeth Siegel, and I'm a policy analyst at the Council of State Governments Justice Center. Before turning to the content of the webinar, I'd like to briefly talk through a couple of housecleaning items about how the webinar is going to work, and then take a brief moment to tell you a little bit about the National Reentry Resource Center and the Justice Center's youth program. Anytime during this webinar, you can ask a question by typing it into the QA panel on the bottom right-hand portion of your screen. We'll keep a running list of the content-related questions that we receive, and then ask panelists to respond to the questions during the last segment of the webinar. We'll do our best to get through as many questions as possible. If you encounter technical or audio problems during this webinar, please call WebEx technical support at 1-866-229-3239. Please understand that there are some technical issues you may not be able to resolve. For this reason, we're recording this event and we'll post it on our website. We should have the webinar posted online early next week, and once it's been posted, we'll email you a link to the recording. The Council of State Governments Justice Center is a national nonprofit organization that serves policymakers at the local, state, and federal levels from all branches of government. We provide practical, nonpartisan advice and consensus-driven strategies informed by available evidence to increase public safety and strengthen communities. The Justice Center's youth program provides state and local policymakers comprehensive research, analysis, and technical assistance that support collaborative and consensus-based strategies that reduce recidivism, improve school discipline practices, and incorporate the appropriate behavioral health interventions for youth and their families. Within the Justice Center's youth program, there are two main areas of focus. The first is the School Discipline and Consensus Project, and the second is the Juvenile Justice Project. The School Discipline Consensus Project is a national initiative to provide policy recommendations for supporting schools that are addressing the impact of suspension and expulsion on students' academic outcomes and involvement with the juvenile justice system. The Juvenile Justice Project is focused on helping state and local governments to protect public safety and help youth who are currently involved with the juvenile justice system become law-abiding, productive adults. In addition to the webinar next Thursday, 9/11, on measuring and using recidivism data to inform policy, practice, and resource allocation, the Justice Center's school discipline and juvenile justice staff will together run a webinar in October on what works to promote educational success for youth in the juvenile justice system. Please stay tuned for specifics on dates and times. The Second Chance Act, which was signed into law in 2008, is the first federal legislation passed by Congress to support federal reentry programs. The bill authorized up to $165 million in federal grants to state, local, and tribal government agencies and nonprofit organizations. Recognizing how complex reentry initiatives are and the importance of integrating research and evidence into those initiatives, the Second Chance Act authorized the creation of a National Resource Center for adult and juvenile reentry. In 2009, following a competitive process, the Council of State Governments Justice Center was selected to launch the National Reentry Resource Center and provide training and technical assistance to all other Second Chance Act grantees. The National Reentry Resource Center is administered by the Council of State Governments Justice Center in partnership with the Bureau of Justice Assistance, U.S. Department of Justice. Since 2009, nearly 600 Second Chance Act grants have been made to government agencies and nonprofit organizations in 49 states for reentry programs serving adults and juveniles. Approximately 20% of these grants have been awarded to agencies and organizations serving a juvenile justice population. The Justice Center is constantly adding new content and resources to our website, and we send out a monthly newsletter that provides information about the latest research, funding opportunities, distance learning events, and other news about reentry. To sign up for our newsletter, please visit csgjusticecenter.org/subscribe. Also, please be sure to visit the website's youth pages at csgjusticecenter.org/youth. The Juvenile Justice Project page provides an overview of CSG Justice Center's juvenile justice specific work. On this page, you can learn about our juvenile justice-related activities and also access seminal publications and resources from the field on juvenile justice-specific topics. The Juvenile Reentry page provides the most current information and resources on what works to improve reentry and overall juvenile justice outcomes.
Liz, this is Sean. I'm interrupting. We're getting a lot of comments from listeners that your audio is fading in and out. So can you just try and make sure that the microphone is stable?
Sure. Is this better?
That sounds good, I think.
Okay.
I'll jump in if it's not.
Great. Thank you. So today's webinar will feature Nastasia Walsh, a Senior Policy Analyst at the Council of State Governments Justice Center. And Nastasia will discuss the 4 core principles that must undergird any strategy to reduce recidivism and improve outcomes for youth in the juvenile justice system, all of which is reflected in the recently released Justice Center publication. We'll then hear how Oregon Youth Authority has operationalized these principles in practice. Panelists from Oregon Youth Authority include Shannon Murick, Paul Bellotti, and Sherry Link. Nastasia is a Senior Policy Analyst at the Council of State Governments Justice Center. As part of her work with the National Reentry Resource Center, Nastasia has provided training and technical assistance to more than 25 criminal and juvenile justice agencies from across the country that are implementing reentry programs for youth and adults returning from secure confinement. She is also a senior staff member of the CSG Justice Center's Juvenile Justice Program, contributing resources and recommendations for improving outcomes for youth in the juvenile justice system. She is also a co-author of the recently released publication, Core Principles for Reducing Recidivism and Improving Other Outcomes for Youth in the Juvenile Justice System, as well as the additional publication entitled Measuring and Using Juvenile Recidivism Data to Inform Policy, Practice, and Resource Allocation. Shannon Murick is a Strategic Initiatives Manager for the Oregon Youth Authority, where she advises the agency's leadership on data-based decision-making. She was instrumental in developing OIA's Youth Reformation System and joined OIA in 2008 as a research analyst before moving into her role as Strategic Initiatives Manager. Shannon is a noted authority on adolescent development and its relationship with juvenile justice, and has lectured and published scholarly articles on the subject. Paul Bellotti is Administrator of Research and Projects at the Department of Corrections and Research Manager at the Oregon Youth Authority. The OIA research agenda supports development of the Youth Reformation System, county juvenile departments, and community partners. Sherry Lingelbach is a Juvenile Justice Information System Policy and Implementation Manager for the Oregon Youth Authority. She has over 30 years of experience at the state and local levels with information systems, research, and data and policy analysis in the field of juvenile justice and pre-K through 12 education. Sherry has worked on the design and implementation of Oregon's Juvenile Justice Information System since its inception in 1997. I'll now turn the first portion of the presentation over to Nastasia. Thanks, Nastasia.
Thank you, Elizabeth, and thank you, everyone, for joining us. As Elizabeth said, my name is Nastasia Walsh, and I'm a Senior Policy Analyst here at the Council of State Governments Justice Center. Before I jump into the report, I really want to give you some background on where juvenile justice is now. As I'm sure many of the folks on the webinar know, the last 2 decades have produced remarkable changes in state and local juvenile justice systems, partly due to the overwhelming research that has emerged showing the poor outcomes and high costs of confining youth. Overall youth confinement rates fell by almost 50% nationally from 1997 to 2011. Some states are as high as seeing an 80% or so reduction in confinement in their states. Obviously, this decline has had a significant impact on youth, on families, on communities, and on juvenile justice systems. For one thing, from a juvenile justice perspective, we know that fewer youth in the system means that we're seeing more high-risk youth staying in the community on probation and more high-risk youth returning to the community after a period of confinement. So with all the emphasis on reducing confinement rates, an important issue that is less talked about is what happens with youth who are diverted from confinement or what happens with those who returned to society after spending some time in a facility. So what are their rearrest rates, their reconfinement rates? How many of them are graduating high school? Or any of the programs and services that they received in the community while on supervision, or any of the things that they experienced while they were in a facility having any impact on their behavior. We know that rearrest rates can be as high as 75% in some states, and many states haven't seen the same reductions in recidivism as they have aligned with the reductions in confinement that they've seen. So why are recidivism rates still so high for these youth? You know, there are a number of reasons why states are still not seeing the results that they want for these youth. There's an incomplete and sometimes misguided understanding of the research. Some systems just don't have the information they need in order to make the best policy and practice decisions. And some only have like half the information they need, or just a portion of the information that they need in order to make full policy recommendations. Second, approaches to adopting the research are piecemeal. So for an example, an approach may reduce confinement for low-risk youth, but then they don't provide quality services in the community for those youth to make sure that they're staying out of the juvenile justice system. We know that there's inadequate fidelity to the research in implementing programs and practices. We know what to do. There's plenty of research out there about, quote-unquote, what works. But there are far fewer resources available on how to do it well. And research shows that even the best programs, when they're implemented poorly, are not going to see the same kind of improvements and actually can do some more harm than good in some cases. And finally, there's insufficient accountability. We actually conducted a survey of juvenile correctional administrators last fall and found that about 20% of state juvenile justice systems are not collecting any recidivism data on youth in their system. So without requiring collection and rigorously analyzing this data, it's hard to hold systems accountable for improving any outcomes when you don't even know what the outcomes are. So the Council of State Governments Justice Center received support from the Models for Change and from the Bureau of Justice Assistance for the National Reentry Resource Center, and worked in partnership with the Office of Juvenile Justice and Delinquency Prevention to produce this paper. While we were researching this paper, we reviewed extensive literature on what works with youth in the juvenile justice system. We worked with a group of key advisors, and we conducted on-site visits with a number of juvenile justice systems that are considered some of the leaders and most innovative in the country. And we also had a lot of interviews and conversations with folks like you on the phone who are working with youth on a day-to-day basis. We know that, while most of the quote-unquote what works research focuses on one aspect of the juvenile justice system, so maybe it focuses on evidence-based practices or what to do with kids while they're on supervision, this report actually distills all of the research on what works into 4 core principles that, when implemented together effectively, are producing the best outcomes for these youth. So we know that the best way to improve outcomes is to keep youth out of the system altogether, right? For those youth who do remain in the system, we must do a better job of ensuring that they do not return. This report provides recommendations for this population, the youth who are staying in the juvenile justice system, about how to reduce their recidivism and improve other outcomes so that they can help transition them into a better adulthood, a law-abiding productive adulthood. I will say at the outset now, the contents of the report can be a little bit overwhelming. There's a lot of information to go over in this webinar because there's no quick fix to improving outcomes for youth in the system. So our hope is that systems will use this report and this webinar to sort of develop their understanding about what works and how these pieces fit together, and then set goals for improvement that are in line with where your system is at now and where you would like to be. All of these, the report is on our website, and the slides and the presentation will be put on our website as well. So let's sort of dive in here. What are these 4 core principles? So I'm just going to read through these real fast, and then we're going to talk about them in depth in the next few minutes. So principle 1 is to base supervision, service, and resource allocation decisions on the results of validated risk and needs assessments. Principle 2 is to adopt and effectively implement programs and services demonstrated to reduce recidivism and improve other outcomes, and use data to evaluate the results and direct system improvements. Principle 3 is to employ a coordinated approach across service systems to address youth needs. And principle 4 is to tailor system policies, programs, and supervision to reflect the distinct developmental needs of adolescents. So we'll start with principle 1. Principle 1 answers the question of who juvenile justice systems should be serving and how we can best meet their needs. So first, just a little bit of background on the research behind this principle. Historically, we found that without objective criteria for making decisions, we're seeing higher commitment rates for youth and associated costs with that, poor youth outcomes, and sort of a feeling that nothing works. We have all seen and felt probably in our experiences that nothing works with these youth, and they're very hard to work with, and sort of a feeling of we don't know what we're at our wits' end. And then probably most importantly, there's a lack of equity here. So we know that youth of color are disproportionately impacted and treated more harshly by the juvenile justice and the criminal justice systems than their white peers. So over the past decade, research and practical experience have established an evidence-based foundation for effectively working with youth in the juvenile justice system. And these principles are known as risk, need, and responsivity, or R&R. So I'm just going to go through the risk, needs, and responsivity really fast. The risk principle states that you want to identify and focus your supervision and your resources on youth who are the highest risk of reoffending. The need principle says that you want to identify and then address the key needs that drive youth's delinquent behavior. So what is making them engage in this behavior? And the responsivity principle is matching youth to services based on protective and responsivity factors. So meeting youth where they are so that we can appropriately treat them so we can get them to a better place. So we know that R&R, risk, needs, responsivity, is best executed through use of validated assessment tools. So while there's no way to accurately predict behavior 100% of the time, especially for youth, for those of you who have worked with teenagers or have teenagers of your own, but we do know that when implemented effectively, these validated assessment tools are shown to better predict behavior than professional judgment alone. So the first step in implementing this principle is going to be to minimize juvenile justice supervision and services for youth at low risk of reoffending, to get rid of sort of that low-hanging fruit, the youth who don't need to be in the system. Research shows that juvenile justice systems can actually do more harm than good. By intervening with youth who are at low risk of reoffending, these youth are likely to age out on their own through the natural aging process of maturing and getting older and sort of moving on with their lives and becoming productive adults. The graph on this slide actually comes from a report from the Florida Department of Juvenile Justice. And in it, you can see that youth assessed as low risk who were placed in residential facilities were arrested at a higher rate than low risk youth who were placed on either intensive probation or diversion services. So youth who are placed in facilities were rearrested at 48% compared to only 28% for youth on diversion. So we know we don't want to have this intensive supervision for some of the low-risk youth because it can actually make them worse. So what we want to do is, whenever possible, use a validated risk assessment to objectively identify these youth who are at low risk of reoffending and then divert them when possible and hold them accountable with other activities like community service and things in the community. So when we have less supervision and fewer interventions for low-risk youth, that means that we have more resources that can be devoted to supervision and services for some of the highest-risk youth. So the next step, after we minimize supervision for low-risk youth, is to maximize the impact and value of system resources by prioritizing services for youth who are most likely to reoffend. Research shows that when well-implemented programs intervene with these high-risk youth, they can reduce recidivism and improve outcomes more than those services that are targeted at low-risk youth. So in other words, you're getting more bang for your buck here. If you have a youth who are already low risk of reoffending, you can't really improve that too much. If the youth is at 10%, that group is at 10%, maybe you can get them down to 8%. But if you have youth who are at that high end, maybe 75% are going to be rearrested, there's a lot of potential to reduce the impact of their recidivism if you can reach them in the right way. In my experience working with a lot of these different sites, I see some places who are implementing sort of intensive probation programs, and they're targeted at low-risk youth or first-time offenders or nonviolent youth. And it sort of strikes me that this isn't really in line with the research because we know that you get the most benefit. Those youth who are the lowest risk should probably be receiving the least amount of supervision because they're going to do better on their own already. And those youth who are at higher risk are the ones who really need that intensive supervision and more attention and more interventions to help them do better. It's going to have a greater impact on public safety. So the diagram here on this slide shows sort of a decision-making model that's based on youth-assessed risk scores, with the most intense supervision and placement being reserved only for those youth at the highest risk of reoffending, and then recognizing, of course, that not all of these youth will need to be confined to have the best outcomes, and those we have probation and residential treatment as options there as well. I mean, research shows that confinement, on average, has sort of a limited and sometimes even negative effect on youth, and it's the most expensive intervention available, cost averaging around $100,000 a month or a year for each youth. Some places I've seen are up to $200,000 a year for each youth. So this option should really only be used with the highest risk youth that have committed the most serious offenses and who can't be effectively served in the community. So we know that risk assessments can identify risk of reoffending, but what about telling us how to keep youth from reoffending? Most risk assessment instruments will look at static risk factors, so things that cannot be changed when assessing for risk. So this will include historical factors like the age of first arrest or the number of previous arrests. But the most effective risk assessment instruments not only tell you who to supervise by talking about their risk of reoffense, but also what they need in order to be successful, what is driving their delinquent behavior, and what to address using your case plan. So research has documented a number of factors that are the primary causes of delinquent behavior. Sometimes these are called criminogenic needs. I like the term dynamic risk factors more when talking about youth in the juvenile justice system. And these factors explain more about why a youth is engaging in this delinquent behavior and then set those targets for interventions. So dynamic risk factors can include things like family and parenting problems, negative beliefs and attitudes, negative peers. Are they friends with other kids who engage in delinquent behavior? Poor school performance. Are they not engaged in any sort of pro-social activities, substance use? So once supervision levels are determined based on risk, systems should use these validated assessments to identify these primary causes and then focus the interventions on these by developing a case plan. So you can see, as illustrated in the diagram on this slide, systems are using a risk assessment tool that assesses for these dynamic risk factors and then use the results to develop a case plan to address these factors. And research shows that addressing these dynamic risk factors in a way that also addresses responsivity factors like mental disorders and learning disabilities can significantly reduce recidivism for high-risk youth. So we know that about 70% of youth in juvenile justice facilities have a diagnosable mental health disorder, and this is frequently going to be co-occurring with a substance use disorder as well. Systems used to use mental health and substance use screening tools along with risk assessment instruments in order to divert some of the low-risk youth with these identified needs to a behavioral health system when it's appropriate. Most risk assessment tools cannot accurately identify these needs on their own, and so you need to have separate screening instruments to identify these behavioral health needs. And then once for high-risk youth who have high behavioral health needs, juvenile justice systems are going to want to match them to behavioral health services in conjunction with the programs that are aimed at addressing their dynamic risk factors. So it's really important to note that mental health disorders on their own are not a dynamic risk factor. They're not something on their own that will be contributing to delinquent behavior. They're more responsivity factors. So it will be really very hard to have a meaningful intervention to change youth behavior if their mental health needs are not being met. So how do you know if you're effectively using risk assessments and making your supervision and services recommendations in line with that? And so we put together sort of these key takeaway questions that you all can use to look at your own system and see if you are having the impact that you're wanting on this. And I'm not going to go through all of the questions now, but you're going to want to be checking, are you using a validated screening and assessment instrument to look at your supervision levels and make the disposition decisions for these youth? Are you minimizing the impact on low-risk youth? Are you prioritizing resources for these high-risk youth? And then are you identifying mental health needs? So once we know what youth need, we must determine, which programs will meet those needs, and then how to implement them effectively in order to get the best results, And finally, how to hold those who administer the programs accountable for obtaining these results. So what impact are these programs having on youth recidivism rates and their outcomes? And Principle 2 provides recommendations on how to do just that. So research shows that ineffective programs are typically going to be based on control, on fear, discipline, surveillance, punishment, such as those programs that are listed up here. So large and overcrowded custodial juvenile correctional facilities, things that are sort of modeled after the adult prisons, boot camps and other disciplinary programs, curfew laws, scared straight programs, no matter what they show you on TV. All of these programs have been shown to be ineffective at improving outcomes for these youth. A meta-analysis by Dr. Mark Lipsey and his colleagues at Vanderbilt University actually looked at 600 studies, and they found that programs and practices like those listed here on the slide that fail to address some of the underlying causes of their delinquent behavior consistently are showing poor outcomes. So the first step is to eliminate the use of programs and practices that do not improve youth outcomes. And that sort of seems kind of obvious, that we don't want to fund programs that don't work. But sometimes, as I'm sure many of the folks on the phone know, they continue to be funded for a number of different reasons. Maybe they're political reasons. Maybe they're systemic or monetary or logistical reasons. What are we going to do with all of these kids when we close down our big facility? But freeing up the funds for these programs that don't work will actually improve outcomes for youth and be able to pay for programs that do work. So since we know that these traditional forms of supervision can suppress delinquent behavior in the short term, but what happens to youth once they're no longer being supervised? We all know if you're being watched, you're probably more likely to be on your best behavior than after you're no longer being watched. So youth who experience this intense supervision and confinement, they frequently go back to their previous behaviors unless they are receiving the appropriate treatment and services to address their behavior. So on the other hand, services that promote youth positive development can reduce recidivism by 40% or more. So the next step then is to support and fund services that work. So we want to get rid of the services that don't work and fund the services that do work. So two approaches have actually been shown to have success with this juvenile justice population. Those are cognitive behavioral therapy and family and community-centric approaches. Cognitive behavioral therapy, or CBT, focuses on changing the way you think and helping them practice the skills they need in order to make better decisions. And then family and community-centric approaches, they seek to sort of strengthen the youth-family connections and improve parenting skills and then connect youth to other positive adults and activities. And I wanted to show this slide as well because I think it really shows the other benefits to working with programs that are effectively implemented. So the Washington State Institute for Public Policy, which is one of the leaders in doing cost-benefit analysis in the country, they analyzed over 500 different evaluation studies as part of one of their cost-benefit analyses, and they found that programs like aggression replacement training and functional family therapy can actually yield significant cost savings. So for every dollar spent on ART for youth and state facilities, for example, you're going to get $37.19 back in terms of improved outcomes for these youth. So eliminating the programs that don't work and then funding the programs that do work will end up in cost savings in the end. I think one of the most important takeaways from all of these studies is the importance of quality implementation. So research has consistently demonstrated that how well a program or practice is implemented is just as important as producing outcomes as choosing the right one, sometimes even more important. In Washington, they evaluated aggression replacement therapy and functional family therapy programs that were administered in a number of different counties. And what they found is that youth who are seen by competent therapists were much less likely to reoffend than youth who saw non-competent therapists. So youth who didn't have a competent therapist for aggression replacement therapy had a 27% recidivism rate, and then those who had a competent therapist only had 19%. And then for functional family therapy, the difference is even more striking, almost half the recidivism rate when youth are receiving competent services. So given the critical link between fidelity to the research and then better outcomes, We want juvenile justice systems to take a systemic approach to ensuring that services are implemented in the right way. So this brings us to sort of one of the big recommendations under this principle, which is the key steps to effective implementation. And these are going to include service matching, so taking us back to principle 1, where we want to match the right youth to the right services based on their needs. Dosage optimization, so making sure youth receive the intended frequency and intensity of services. And this comes up a lot for me when I'm working with different sites that are struggling with having either too long of a length of stay and seeing sort of diminishing returns from working with youth for that long, or they don't know how long to keep youth in a specific treatment program. Quality assurance, so developing standards for minimum qualifications for staff, training protocols, having written protocols around service delivery, templates for case plans, that kind of stuff. Quality assessment, so evaluation of service provision. So there's a bunch of different tools out that a number of different jurisdictions are using right now. You've got the correctional programs checklist and the standard program evaluation protocol, the STEP, that are making sure that these programs are being implemented in a high-quality way. And then implementation assistance. So is training and support available for service providers and for folks in the juvenile justice system by experts to make sure that these programs are running well? And then data collection and evaluation, which we're going to talk about right now. So the ultimate proof of whether juvenile justice systems are employing effective services is obviously going to be lower recidivism rates and more positive youth outcomes. We need to collect and use data in order to know this information. So juvenile justice systems can actually make better decisions by implementing these 5 key recommendations. And just as a teaser, these are the same recommendations that are going to be included in an issue brief webinar that we're putting on next week that we'll talk about a little bit later. But first and foremost, you just have to measure these outcomes. So you want to be measuring recidivism, measuring these other youth outcomes, and considering the multiple ways that youth have contact with the system. So if you're only looking at rearrest, you may not be getting the full picture of what is happening with youth in terms of technical violations and being returned to incarceration. Or if you're only looking at youth who return to the juvenile justice system, then you're going to be missing out on the youth who are getting in contact with the adult criminal justice system, which should still count as recidivism. So once you're collecting all of that information, you'll be able to analyze that information. So we want to be looking at youth risk levels. How are youth at different risk levels engaging in this program, and how are they doing, and what are their outcomes, as well as characteristics like length of stay, specific programs, specific facilities, or specific supervision levels. To do this, a number of the sites that I work with have developed an infrastructure to collect and analyze this information through an electronic case management system. And then, of course, importantly, what would we do if we didn't share this data with other people? So you want to make the data available to the people who need it, to leadership, to policymakers, and to the public as an accountability measure. And then use this data to inform juvenile justice policy and practice and the way that we're allocating our resources. And again, we've got this checklist here, sort of key takeaways from this principle. Is the juvenile justice system required or incentivized to use programs that work? Are they eliminating funding for programs that don't work? Do they have specific training and opportunities available in order to implement programs well? And are they holding places accountable for making sure that they're running these programs effectively? So once the lowest risk youth are diverted from the system, these juvenile justice systems are left with moderate and high risk youth with an array of needs. We've got mental health needs, substance use needs, child welfare involvement, and educational needs, which can all contribute to their delinquent behavior. But juvenile justice systems alone don't have the expertise or the capacity to address all of these needs alone, nor should we want them to, really. And so a lack of collaboration with these other youth-serving systems can and historically has led to some negative effects. We've got duplication of efforts, we've got bogged down service delivery, unclear roles within the agencies, and a poor use of services. So Principle 3 really discusses who juvenile justice systems should partner with in order to address youth needs, given limited resources and multiple needs of these youth. So we know that about 60 to 70% of youth in juvenile facilities have a mental disorder. 25% 25 to 50% of these youth have a substance use disorder. They're often co-occurring with mental health disorders. About 65% of youth in the juvenile justice system may have current or past involvement in the child welfare system. And then youth in the juvenile justice system are significantly more likely than their non-delinquent peers to receive expulsions, suspensions, drop out of school, have low academic skills, or a learning disability. So there are a number of key ways that juvenile justice systems and partners can address these youth needs. For mental health, we know that failure to accurately identify and appropriately treat mental health disorders can exacerbate conditions and actually make them less able to participate effectively in programs to improve behavior. So what we want to do is we want to make sure that we're identifying their treatment needs, making sure that we have capacity to serve their needs, preferably in the community, but in facilities as well, whatever is best for the youth based on their risk level and their needs. And then providing for a continuity of care between facilities. We want to make sure that there's no gaps between when a youth leaves the facility and when they start their mental health treatment, specifically for medication, but also for treatment in general. And so we want to have that continuity of care by having the two systems be joined together and understanding what the youth needs and how to treat them. Similar to the process with youth with mental disorders, we also need to identify treatment needs for youth with substance use. We want to provide effective interventions to them, preferably in the community. And we want to provide ongoing support for relapse. Child welfare youth typically stay in the juvenile justice system longer than their peers, and they're actually at a greater risk of reoffending than their juvenile justice peer, as well as those poorer life outcomes. So to best meet their needs of these youth, we want to ensure that systems are sharing information. I can't tell you how many places I go to who can't tell me how many of the youth in their system are involved in the child welfare system because the systems don't talk to each other, involving families in all of the decisions, and then collaborating on case planning and services, which we'll talk about a little bit later. Finally, juvenile justice and education systems are going to want to work together to keep youth in school, to establish high standards for correctional education, and to facilitate effective school re-enrollment after youth have been in confinement. Since we work on reentry grants here, we work with a lot of different grantees and jurisdictions that have significant problems sharing information, transferring of records, making sure that youth are re-enrolled in school the first day that they return. These are all very important in order to make sure that youth can continue their education and are not missing any steps and getting left behind again. Just as a plug, and something that Elizabeth talked about in the introduction, we also put out a school discipline consensus report earlier this year that provides really in-depth information about school climate, re-enrollment, and correctional education that you can access on our website as well. So the checklist here's some key questions that systems can ask about determining whether or not they are effectively collaborating with other systems. So does the juvenile justice system partner with behavioral health, with child welfare, with education to identify these youth, promote success, and support their transition back into the community? Are these groups participating in a task force or some sort of reentry staffing where they come together to talk not only about individual youth and the case plans for these youth, but also larger policy decisions about what should be happening with these youth and how to better transition them? And are they sharing data? I've seen very, very few, if any, sites that have one single database for all youth in a jurisdiction that all of these different service systems can access. But I have seen plenty of places that have great information sharing agreements together so they can very quickly identify youth from the other systems and get their information and be able to collaborate to develop a case plan that works for everyone. So long-standing research shows that most youth will naturally age out of delinquent behavior without formal intervention. This includes youth who commit some of the most serious offenses. Yet, many of these youth continue to struggle with some of their long-term academic and employment success even after their juvenile justice involvement. So along with the steps in the previous three principles, juvenile justice systems really must sort of undergo a fundamental shift in the way that they work with youth to tailor interventions to reflect the unique needs that youth face and then strengths that they bring to help them successfully transition to productive adulthood. And Principle 4 really addresses the need to develop a developmentally appropriate approach to working with all youth. So anybody who's interacted with a teenager knows that they're more than just mini adults. Those who work with youth on a daily basis know they tend to engage in risky behavior without sort of thought to consequence or at all sometimes. They're relatively insensitive to different degrees of punishment, and they rely really heavily on their families and their peers to form their different beliefs about what is appropriate. So ignoring sort of these distinct aspects of their development can really undermine all of the other good things that you're trying to do with these system interventions. So what we see is a developmentally appropriate approach to sort of undergird all of the policies, programs, and supervision. And the following recommendations on the next few slides are going to tell you what this looks like in practice. So research shows that youth who have supportive caregivers also have better outcomes than youth with less supportive caregivers. And in contrast, youth with caregivers who fail to provide consistent structure and support are at far greater risk of delinquent behavior. So the first step is to engage families and other supportive adults in major system decisions and processes. And the first step to doing that is to identify supportive adults. So these are not always the biological parents. Sometimes the biological parents are not in the picture, or they are not in a place in their own lives where they can be the supportive caregiver that they need to be for these youth. So a number of states and jurisdictions that we look at are using programs like family finding and family genograms and the juvenile relational inquiry tool from the Vera Institute of Justice to help better identify caregivers. And these can be folks who are teachers, coaches, mentors, neighbors, or uncles or aunts, folks from the community who could really rally around this youth and be support for them. And then engaging those people into the decision-making process about these youth. We read through a survey of more than 1,000 families of incarcerated youth and found that 80% report no involvement at all in system decisions that involve their children. And when I go on site with one of my consultants, he frequently asks the site, well, what would you want to happen with your own child? And folks want to be involved in the decisions that impact their youth, and it takes a lot of effort sometimes on the part of the supervision agency and on the part of the parents to open up that communication and make it be a process where they're really involved in those decisions. There's a couple of different ways you can do that. There's youth family team meetings and family group decision-making models, or family liaisons. I work with one jurisdiction that has a family liaison, and it's a woman who had a youth who was involved in the juvenile justice system there, who was specially trained to work with other families to provide a support, be an advocate, provide information, and she also helps sort of open the lines of communication between the parents and the supervision officers to make sure that they're engaging with each other. And we also want to be supporting mentoring programs that are using an evidence-based model. So I think on its surface, one thing that people who know absolutely nothing about juvenile justice may notice is that we use different language in the juvenile justice system than we do in the adult criminal justice system. You know, we use adjudication instead of trials. We use confinement instead of incarceration. And I think the language is sort of a minor difference compared to the way we should be treating our youth and the differences between how we treat our youth. So rather than mirroring the adult criminal justice system for our supervision policies, this recommendation really suggests that we employ a developmentally appropriate approach to supervision by focusing on promoting positive youth behavior change and then using graduated sanctions. We really want to be repositioning the role of supervision officers to spend less time monitoring conditions of supervision and more time helping to address the primary causes of youth behavior. So more time helping and less time sort of waiting for the youth to do wrong or watching for the youth to do something wrong. So there's a number of ways we can shift this focus, and they're listed on this slide. So, for example, we need to establish appropriate conditions of community supervision. The juvenile justice system can inadvertently set youth up for failure by sort of establishing a laundry list of conditions that youth and families might not understand or cannot realistically achieve. Instead, we want to create developmentally appropriate conditions that are tailored to each youth and that meet their risk levels and their different needs. And as we talked about before, we know adolescents are particularly responsive to external rewards and relatively unresponsive to degrees of punishment. So we want to use more incentives or rewards for positive behavior and more graduated sanctions for negative behavior or violations. You know, even small victories and small rewards can have a huge impact. I remember talking with some youth who were in a facility when we were on a visit, and they kept talking about how they really enjoyed participating in this program because afterwards they got candy bars. And they were so excited, and I swear they talked about these candy bars for like half an hour about how it's so exciting. And it's just a minor thing that is an incentive for these youth to participate rather than just providing sanctions to what they're doing. That said, of course, youth need to learn from their mistakes, and for violations, we want to make sure that systems are employing sort of a graduated response model or matrix, like the one here listed on the slide, that provides optional responses that are based on youth risk level and then the severity of the violation. So if a youth does something really minor, we don't want to be automatically shipping them back to a facility. We want to be looking at some sort of intervals of how we can intervene with that youth to make sure that we're holding them accountable for that behavior, but it's also in a developmentally appropriate way. And like I said, I mean, it's critical that youth are held accountable for their actions, but we also don't want to conflate accountability and punishment, especially since punishment is associated with some of the worst outcomes going back to some of Dr. Lipsky's research. So growing evidence suggests that things like restorative justice accountability practice can improve youth behavior. They increase youth and victims' satisfaction with the legal system, and they reduce victims' post-traumatic stress and related costs with that. So this can include programs like community service, mediation, family conferencing. And finally, research shows that youth perceptions of how fairly they're being treated affect their attitude about legitimacy of authority and thus their compliance with the law and supervision conditions. If you feel like they're being treated unfairly, they're going to have less respect for the law and less respect for their supervision officer, and they're not going to follow the rules. So to sort of improve these perceptions and improve the way youth are being treated, juvenile justice systems really can give youth sort of meaningful opportunities to help shape the decisions around their case, to change their service environments to make them more open, and opportunities for learning, and then interventions that affect them, and then while also improving system equity. So like we said at the beginning, you know, youth of color are disproportionately represented at all phases of the juvenile justice system. This slide provides some recommendations for how to advance procedural justice system, including, you know, providing opportunities for youth to participate in these decisions, as well as larger policies. So some places have youth councils where they can bring stuff to leadership in the juvenile justice system. We want to collect data on the impact of different racial groups, as well as other marginalized groups like youth with learning disabilities, LGBTQ youth. And also training staff in appropriately and fairly working with youth so they can address some of their internal biases. And the last sort of key takeaways here to see whether or not you're employing a developmentally appropriate approach. So are youth and families meaningfully engaged in some of these key decisions? Are the conditions and the required for the youth who are on supervision, are they reasonable? Are they achievable? Are they understandable? Are your supervision officers focused more on engaging youth and being supportive for them rather than just monitoring and compliance? Are you using graduated sanctions and more incentives to improve youth behavior? And are you holding youth accountable for their actions in ways that are developmentally appropriate and that improve the harm that they did to victims? So as my last slide, I just want to note that, you know, the core principles that I discussed is a lot of information, but they really offer juvenile justice systems a roadmap for what to do and how to do it to improve outcomes for these youth. So as an additional resource, the Justice Center is also publishing an issue brief that provides guidance on how to evaluate the impact of these efforts for data collection and use. We know that about a quarter of states use data as the primary driver of policy, practice, and resource allocation decisions. But that means that 75% are not using data as much as they could be. So This brief actually provides recommendations about how to improve this practice, and there's some information there about how you can sign up for a webinar next week during this time. Thank you all for your time.
Thanks, Nastasia. We'll now hear about the experiences of Oregon Youth Authority in applying some of these principles in practice. So I'll now turn it over to Sherry Lingelbach. Thanks, Sherry.
Hi, thank you. Thank you, Elizabeth. So the foundation of Oregon's ability to use data effectively in research and in practice is basically having data. And how we have data is through our Juvenile Justice Information System, JJIS. JJIS is a statewide integrated juvenile justice information system shared by all 36 county juvenile departments in Oregon and the Youth Authority. It provides a comprehensive view of youth offender cases tracked throughout the entire juvenile justice process, from referral to the juvenile department, through the court process, and finally through supervision, custody, treatment, and reentry, regardless of where supervision is provided, either at the front-end county juvenile department community level or through the deep-end Youth Authority, the correctional agency. Essentially for us, JJIS means one youth, one record. Core standardized data across our 37 participating agencies include information about referrals and dispositions, accountability conditions like restitution and community service, detention and close custody episodes, and some information about programs and services. Additionally, the system has the capability to collect data on a multitude of other topics, such as assessments, case plans, treatment group attendance and engagement, positive youth participation in vocational work experience and educational services, incident reports, and general case management. These additional features are optionally implemented by each jurisdiction when they are ready to take on the operational challenge of restructuring work to integrate the features into natural workflow. JJIS is a partnership formed in response to a 1995 legislative mandate to create extensive data related to the juvenile justice system in Oregon. We designed, developed, and implemented JJIS statewide across our 37 autonomous jurisdictions and a number of approved external partner agencies in support of a goal to have a juvenile justice system that provides a continuum of services and shared responsibility among all members of the juvenile justice community. JJIS is managed by a cooperative governance structure and led by a steering committee of partnership leaders who recognize and support the common business needs across the partnership, strive to create efficiencies, eliminate duplicate data entry, steward the data, and ensure confidentiality and protection of the data, and plan for the best interests of the juvenile justice system as a whole. Consequently, JJIS has become the primary operational information system for its internal partners, the Youth Authority and 36 county juvenile departments. In fact, the success of the system and the key to data integrity lies in a deliberate intention to design a system that would support daily operations and not simply as a mechanism to collect data. Good quality data, which, while a desired side benefit, is only possible because, as one juvenile justice professional recently told me, quote, "the juice was worth the squeeze." Today, there are nearly 429,000 unduplicated youth records in JJIS, and today, approximately 12,500 of those are currently active cases across the state. Now that we've collected the standardized data for so long, JJIS is also now able to provide data in support of approved research, as well as several statewide publicly available annual reports. Both efforts, research and annual reporting, support policymaking and inform system stakeholders and the public about the juvenile justice process in Oregon. One of the visions of the steering committee is that JJIS will create the capacity for aiding in overall planning, development, and evaluation of programs designed to reduce juvenile crime. Since 1995, we've been growing a knowledge database about outcomes relevant to the functions and programs of our system and are now entering the area where we're reaping the benefits of all that data, and we're now in a great position to effectively evaluate programs aimed at reducing juvenile crime. I mentioned earlier that JJIS is a collaborative partnership across the juvenile justice continuum, and it's managed according to a strong set of partnership governance principles. These principles are codified in state statute, administrative rule, and formal interagency agreements. Additionally, the partnership has created a number of formal interagency policies and standards that guide consistency in data entry across the core required data elements. This slide provides a graphical overview of the juvenile justice continuum in Oregon and how it fits in with the larger community context. JJUS data encompasses all of the juvenile justice business functions of the yellow shaded area. So, while JJUS itself is the daily electronic operational case management system, in the technology world, this is also known as the transactional database. The Oregon Youth Authority also manages a JJUS reporting system. This reporting system is a copy of the JJUS database, along with some additional reporting tables from which we can create operational management reports and data extract files in support of research and analysis. We also receive and upload adult sentence files quarterly and run a matching process which enables our ability to automate recidivism reporting and look beyond juvenile recidivism and on into the adult system. We have over 700 reports that have been developed to support the daily operations as well as analysis for research. Our county juvenile department partners currently have access to all of these reports in a shared, secured environment. We are also beginning to create a data warehouse, which will organize the data more efficiently for reporting and analysis and provide more opportunities to transform the data into meaningful business intelligence, ad hoc reporting, and graphical representations of the data, like dashboards. All of the new predictive probability formulas and youth reformation system research that you're going to hear about in a minute, those tools are computed in this reporting environment. In the future, Excel and SharePoint tools will allow use of the data from both the current reporting system and the data warehouse. This effort will enhance our ability to support the needs of research and more efficiently deliver data analysis in a timely fashion. This slide provides a picture of our current reporting environment with the addition of the data warehouse tools. When the data warehouse is fully operational, the reports database structure will be retired. And finally, a benefit of the research is the ability to improve system performance and outcomes for youth, obviously. But for research to have merit, it needs to be based on valid data. We want to integrate our new research tools into practice as soon as they have been validated. Since research analysis is computed in our reporting environment, we need to obtain those tools and display the use-specific research-based scores into JJUS, the Daily Operational Case Management System. This will make the data accessible by caseworkers when they need it. And we see this a bit as a cycle. Daily operations yield quality data, which can be analyzed and turned into reports, research, and predictive analytics. These research tools can inform practice and support program evaluation efforts. All of these data can be incorporated into JJUS, which can inform operational decision-making on a daily basis and lead toward more intentional implementation of evidence-based practices. This will lead to more complete data and data integrity in JJUS, and so on. And so the cycle will produce, hopefully, improved outcomes.
Thanks, Sherry. This is Paul Belatti, and we're going to move from the data to the research and analytics. What we're trying to accomplish with the research and the analytics is to develop a more effective and efficient system and to enhance professional discretion of those working with the youth on the front lines. What we're trying to do is look at the entire juvenile justice continuum without adding a significant amount of effort on the front lines. And so Fairboris Paxares, the director of the Youth Authority, asked a number of questions and asked research to develop some methodologies that would address some of the issues that he had, including what should the capacity be of our system in the future. And in addition, are we bringing the right kids into the system? What should be the proper length of stay? And what interventions are necessary? And do we have all the proper interventions to best serve the youth today? And so research has developed a number of methodologies that I'm going to described here. So I'm going to take the first two questions that he's got there because we used a single methodology for the two, and I'll describe the methodology that was developed for the other questions that he had for us. So, and I'm going to illustrate it using an example. So if Fair Boards is our newest candidate for OYE services, the system really has three choices on where to put Fair Boards. They can leave them at home in the community. They can move them to residential treatment, which is essentially out-of-home care in a non-secured environment, or we can send them to what's known as closed custody here in Oregon, which is a secured facility and it's confinement. And so those are the three choices that we have for Fair Boards. And what we've done is we've gone in, and Fair Boards, whether he knows it or not, has a lot of identical twins. And those identical twins, some of them are left in the community. And so we can look at those identical twins and say, what's the recidivism rate, if recidivism is the outcome of interest, of the identical Fair Boards that were left in the community? Similarly, there are a lot of Fair Boards that also went to residential treatment, and then there's also many Fair Boards that went to closed custody or a secured environment. And so we can look at the recidivism rates of his identical twins, those who are left in the community, those that went to residential, and then those that went to a secured facility. It tells us a lot about where we should send Fair Boards and the likelihood of success in those three different environments. And so what we've used, basically, we've used a profile of needs, risk, and age when we're looking at Fair Boards' identical twins. And so we can have a little bit more information as to where we can best serve Fair Boards, and that essentially addresses the second question, are we bringing the right people into the system or not? It also implies that some of the higher risk individuals might be left in the community. And historically, the highest risk individuals probably come to a secured environment, the moderate risk wind up in some kind of residential facility, and the lowest risk wind up in the community. This might change that a little bit. One of the questions he also had is, the first one listed here, what should be the capacity of our system? Most of the capacities of the number of beds that are out there today reflect what the legislature believed at the time the Youth Authority was created, and then it's affected basically by budget and probably by crime rate and a number of other things that impact the legislative system. But there's very little evidence-based information that the number of beds that any state has reflects how to best serve the youth in that state. And so he asked us essentially to develop a methodology that would give us a number of residential and closed custody beds here in Oregon that would best serve the youth. And so, Fair Boards, we have three estimates for him. The likelihood of success if we leave him at home, the likelihood of success if he winds up in residential, and the likelihood of success if he winds up in a secured or confined environment. And so we can look at those estimates and decide where to place Fair Boards. Well, we can do that for everyone else in the system today. And so we can look at where individuals are and where they should be if we want to minimize recidivism for this particular example. And that will give us an estimate of the number of beds that we need, both secure beds and residential, and how many you should be left in the community if you're trying to reduce recidivism. And so if you do that today, and you do it 6 months from now, a year from now, and so on, it gives you a pretty good idea of how many beds you need in each of these different environments. It does not address the long-term need of the Youth Authority, and I'll get into that a little bit later. And so it tells us something about the capacity. And so we used a single methodology basically to address the first two questions. What should be the proper length of stay? We used a fairly simple analysis to give us a general idea of what the appropriate length of stay should be. And basically, we illustrated using a schematic. And on the vertical axis, we have recidivism. And on the horizontal axis, we have length of stay, either in a secured environment or a residential treatment facility. So if you look at the individuals that were in for 3 to 6 months, what's their recidivism? Those that are in for 6 to 9 months, what's their recidivism, and so on. And if you look at the actual graph and connect the dots, it'll go from the upper left to the lower right, and then we'll basically start paralleling the at leveling out is really the optimum dose or the optimum length of stay. And I'm simplifying a little bit here, but basically that's what it looks like. And so some of these facilities or residential treatment facilities believe they have an 18-month curriculum, but you might actually attain what you have, the desired results within 9 to 12 months. And so what we're trying to do is assess whether you're using your limited resources in the best way you possibly can. And so that schematic allows you to identify basically where that optimum dose or optimum length of stay should be. The fourth question deals with the interventions needed to maximize success, and we call that service matching here. And earlier I described how we would place fair bores either at home, leave them at home, place them in a secured environment, or place them in residential treatment. And really what you're trying to do is look at the identical twins and then ask what's the likelihood of success. You can use the identical methodology for, let's say, all the drug and alcohol programs. There are a lot of fair bores lookalikes that have gone to a particular provider and a second provider and a third provider. And the same methodology then allows you to identify the most effective drug and alcohol program for fair bores at a given point in time. And so that same methodology is used to address 3 of those 4 questions, although it's used slightly differently. If you look at the next slide, there's another series of questions. How do you hire and support a workforce that is effective with youth that we serve? And from the research perspective, there's a couple things that we can contribute here. It's clear that when you hire, let's say, a superintendent of a confined or secure custody facility, that superintendent sets the culture. They hire the individuals, they train the individuals, and you tend to develop a culture for any given facility. And when you walk or you go among the facilities in a given state, you can easily see that there's cultural differences among the different facilities. Well, that culture affects how well some youth do. Not all, but some. And just as some of the teachers that you were growing up with, some of which you aligned well with and understood and made a lot of progress, there's others that you didn't do well with. And it just has to do with the personality differences that you and this teacher may or may not have. Well, it works the same with youth. And here, the cultures that are associated with their most effective facilities are the ones you need to promote. And the ones that are least effective are the ones you need to try and modify as best you can. The next bullet, how do we create environments where youth are viewed as assets and resources to be developed? I'm just going to let Shannon take that in a second. She has dealt quite a bit with positive human development and can tell you more about that than I can. How do we support integration of youth into the communities in ways that support success? We've developed a lot of actuarial risk assessment equations, and we use a lot of the youth information to develop the actual estimates. However, we know communities influence those estimates, and they have to be factored into a transition system. And as a result, if you know an individual is going back to a community that is going to be less supportive than another community, we basically have to provide more support services and recognize that there's more needs there for that particular youth because that community influences that individual's risk. So knowing what that risk is and quantifying the risk associated with a particular community is very important to us. And then the last piece, how do we know our investments are effective in achieving the desired result? We're all about quantifying effectiveness of programs, and we're all about doing cost benefit. And we use the model that was developed by the Washington State Institute for Public Policy, and it's a tremendously useful tool as long as you understand the assumptions that go along with it. And so if you look at the next slide, which looks at the youth reformation system, there's 4 components. And what we've done is compartmentalize some of these things and some of the questions that Fair Boards has asked over time into these 4 components. And the other one that's the underpinning of all this is positive human development, which Shannon will talk about in a second. If you look at the 4 components, the population forecast deals with the immediate or short-term forecast, and that was illustrated by where to place fair bores, either leave them in the community, place them in residential treatment, or a secured environment. we can develop estimates of how many beds we actually need. That's great for a year or two. It doesn't do a good job with estimating long-term need. And so to estimate long-term need, we've relied on data from other agencies like welfare and child welfare and education and drug and alcohol, as well as arrest data here in this state. And you can start looking at individuals that are aged 2 to 7, long before they become identified as possible clients in the youth system. And some of these kids will actually be known to the system, and then will accrue additional baggage or jettison baggage along the way that increases or decreases the risk. But identifying who they are early also will help serve them later on. But right now, it tells us something about the need 5 to 10 years down the road. And so our long-term forecast, which hasn't been fully developed yet, we'll rely on this other data and estimate our need 5 to 10 years out. The placement and treatment component deals with service matching. Do we send the right youth to the right place at the right time? Transition and recognizing risk in the community. And then also monitoring change while they're in different facilities to recognize when to move them on and when to transition them back to the community or another type of facility within the system. The third component is the program evaluation continuum. There's actually 5 components, including how we quantify the effectiveness of programs. And basically, what we're trying to do is develop feedback mechanisms to the programs so that they can continually develop feedback information that goes to the agency leaders to ensure that basically our programs and services are well aligned with youth needs. And then the last feedback mechanism goes to the legislature. And most of that has to do with cost benefit. And so the program evaluation continuum has a lot of different components, but essentially winds up in one of those 3 buckets to provide feedback mechanism to ensure there's continued success. And the last piece is the community context, which actually has quite a bit of promise in the long run, which looks at identifying the youth and family characteristics that are associated with increased or decreased risks of coming to the youth authority. And the flip side of it is what happens to the youth after they leave the youth authority. How many of them wind up as parents in the child welfare system? How many of them wind up in the welfare system? How many of them get an education and actually get jobs that are family wage jobs and so on? So those are the 4 components. What I'm going to do is hand this off to Shannon, and she'll discuss the last 2 slides.
Thanks, Paul. Good afternoon, everyone. The slide that you are seeing now, hopefully, indicates how we've kind of situated this youth reformation system that Paul just mentioned, using the data system that Sherry talked about, into kind of the general philosophy of how the youth authority is choosing to do business. And as you might have picked up on by now, our data system and some of these research questions extend beyond just what the youth authority is able to do. We partner with our juvenile departments. We partner with our local district attorney's offices, judges. Folks have an investment in this information. It helps them make decisions in ways that are beyond just what we might have in our span of control for the youth authority. So the system does have to be held to a pretty high level of accountability and making sure that it benefits all of our parties. That outer circle is the youth reformation system, and really, as Paul's done a nice job of defining, it uses data, research, and predictive analytics to inform decision-making at all of those levels, with the primary goal of supporting our professional discretion and another primary goal of improving outcomes for youth. And in Oregon, we've defined improving outcomes for youth in a number of ways. Notably, we want to reduce future victimization and recidivism, but we also want to make sure that youth are leaving our system equipped to be productive members of their community. And that's the positive youth outcomes piece that many of you on this call are likely familiar with. The next circle is our culture, and that's a pretty important part of us being successful. I think sometimes when you talk about using data to inform decisions, that can create a certain level of concern or anxiety for folks. And what we'd like to do is make this information something that supports curiosity rather than fear. And part of that is making sure that you have a culture that supports asking the right questions and using that information in ways that benefit youth and the families that we work with. The circle that references our approach refers to practices and tools, and these are the approaches that we use to engage in and work with the youth in our custody. And I think in the first part of our presentation today, we learned a lot about evidence-based practices and those types of practices that tend to work well, specifically integrating communities into the treatment plan and using cognitive behavioral therapies are all things that we would consider the tools in which we work with youth effectively. And the most inner circle refers to our general belief about making sure that we're doing the right things when we're doing everything that we can to ensure the best outcomes. And so when we talk about performance management, we think about that at all different levels. Not only are we accountable to our citizens as a state, but we are accountable internally to our staff and to our youth. I want to take a few more minutes just to talk a little bit about that culture circle. Since we've talked about the data and we've talked about the research questions, what we're in the process of doing right now in Oregon is really intentionally implementing a lot of these things, and part of that is to do so within this culture of success as we've defined it in this pyramid. And you'll notice that there are three circles. One says youth success, the one in the lower left refers to staff and partners, and the one in the lower right refers to our organizational structure. And we were very intentional in thinking about if we hope that staff will engage with our youth in ways that reduce recidivism and increase positive youth outcomes, our agency needs to work with our staff in a similar way to help our staff use their best skill sets in the right way. So it really becomes a place where we all own a piece of this culture of success. The first layer refers to safety and security, and we extend that definition beyond the traditional correctional notion of safety and security, so things like physical safety, reducing contraband. We expand that definition to include things like psychological and emotional safety and security, the use of trauma-informed practice, understanding the context that our youth come from. And we also think about what do staff need to feel in order to be equipped and ready to do their job with the youth that we work with. The second layer of caring and supportive relationships is paramount, and we have states all over the country that also do a very good job of forming what we would call a therapeutic rapport with the youth that are in the juvenile justice system. And so we've taken a lot of lessons from other states that partner with us on these concepts. But what we believe is that when communication is respectful and productive and that an individual feels cared for and supportive, we're much more likely to achieve our outcomes. We've created a sense of safety and security, and now we've established that relationship that for young people is exceptionally important in helping in reformation. That third level of high expectations and accountability is where we hope to have skill development, not just accountability for the things that you've done in the past, but what is your accountability for the things that you're going to do in the future? What are the expectations that we have for you as a young person? And we want those to be clear, but we also want our staff to understand what's expected of them and what accountability means to them. The layer of meaningful participation is making sure that folks have the right things that they need to do to engage in our environment, whether you are an employee coming to work or whether you are a youth who is receiving services from us. Do you have everything you need to meaningfully participate? Because authentic engagement in that sense is also very helpful in reducing future criminal activity and making sure that youth are equipped to be productive. And the last piece, which I know we've learned a lot about in the first part of our presentation and was also referenced by Paul, is that connection to their community. Many of our youth, if not the great majority of our youth, are going to be returning to a community of some sort. So it's really important that we start in the very beginning to rebuild those connections to ensure that the community is aware of the youth that we're working with and understands what they might need when they transition back to their local communities after receiving services from us. So when we think about how to implement a lot of these concepts, it really does you do kind of have to consider that culture of operation and making sure that you have the right supports in place for people to be able to use that data in a meaningful way and that we're surrounded around a unified goal of achieving those youth success outcomes. And that concludes our portion of the webinar. I will turn it back over to Elizabeth. Great. Thank you, Sherry, Paul, and Shannon. The final portion of the webinar today will be devoted towards addressing questions that came in, and we have time for a few questions. The first is for Nastasia. Nastasia, in regards to the issues of lack of fidelity to program models, does this lack of fidelity occur when stakeholders and states try to fit models into their existing structure? rather than creating a structure that's designed around these successful models. If you could talk more about this, that would be great.
Yes, absolutely, and thank you for the questions that have been coming in from everybody. So we know the programs that are developed within evidence base are developed to run in a very specific way. And when what we see in a lot of different jurisdictions is that folks are trying to customize them a little bit to fit what their office, what their system's culture is, or what they think is the difference between their youth and what their youth need. And really, what we should be doing is the latter of that question, which is to be structuring the system to fit into the model's program. So we really want to be doing exactly what the model is telling you to do, and that's why there's such an important part for implementation there, is that you want to make sure that if you're doing functional family therapy or multisystemic therapy or aggression replacement therapy, that your staff is properly trained on how to do the model exactly as it is laid out, because that is the way that is showing the best outcomes. Any sort of diversion from the model can have an impact on the outcomes there. So it's really important to have that training for new staff when they come in, have booster trainings, and have experts really come in and help supervise and make sure that there's a fidelity to that model.
Great. Thanks, Nastasia. The second question is directed to OIA staff. This question says, are there any suggestions on how to fund and support a project like JJIS and available resources and suggestions to help the development and implementation of this type of system?
Yes, this is Sherry responding. We received a burn grant early on in the process that helped us fund the initial launch, but we also received funding from our legislature to help us do the proof of concept, and I think one of the elements to leverage legislative funding was signed intergovernmental agreements from all of the county partners. There was an initial project funding and the grant funding, but ongoing funding from the legislature was contingent on those signed intergovernmental agreements. So I would say one suggestion, I don't have any particular suggestions as far as a source, but demonstrating that commitment to the partnership and commitment to all of the multiple jurisdictions committing to participate collaboratively in sharing data and building a common information system.
Great, thank you. And this other question is directed towards OIA as well. This question is related to the sharing of data, reporting of data. Can you talk a bit about what kind of data is shared with some key stakeholders like policymakers and judges, of course? You could extend on that.
Absolutely. So this is Shannon responding to that question. The types of data that we are sharing with those partners include information about a youth's specific criminal history, their risks and needs. We share that information with, in our state, we typically have a number of different individuals who get involved in a youth case at the very beginning. We call them resource committees or planning committees. And those folks include juvenile department staff, local parole officers, judges, district attorneys. All of those folks might be getting that information. And we do that in kind of a package deal where we ensure that they're receiving as much information as they can about a youth case, that they understand where we've been successful with youth like this in the past, where we're likely to be successful in the future, but also tying in that context piece. So is the family super stable? Do they have a specific educational need that isn't likely to be met unless they go to a certain service level? So we really try to create that comprehensive picture that, again, supports professional discretion and supports a decision that is youth-centered and not system-centered, if that makes sense.
Great. Thank you very much. So we're nearing the end of the webinar, and I want to again thank Shannon and Paul and Sherry's team from OIA, as well as Nastasia, for sharing this information with us. One of our priorities at the Justice Center is to really ensure that juvenile justice systems and different membership groups consider how they can use the principles highlighted today to really improve outcomes for youth under system supervision. While the Justice Center has limited amount of resources to present to systems, if there are systems or organizations on the webinar today that are interested in support in an in-depth and tailored way, you should feel free to reach out to Ms. Stasia, whose contact information is listed in the slide in front of you. So this concludes today's webinar. After you exit the webinar, a brief survey will appear on the screen. By answering the questions in the survey, you'll be helping the Resource Center improve on the services we offer. And so we'd greatly appreciate it if you take just a few minutes to complete that. We'll be emailing a link to the recording of this presentation, as well as a link to a PDF of the PowerPoint slides used in the presentation early next week. And these links will also be made available on the National Reentry Resource Center's website. And again, please remember to subscribe to the National Reentry Resource Center's newsletter at csgjusticecenter.org/subscribe. Thanks again for your participation in the webinar, and have a great day.